And the next speaker, Dr. Akash Sandeep, to speak on comparison of visual outcomes of Indian Appasamy and Vivinex toric intraocular lenses.
Good morning everyone, myself Dr. Akash today. Today I will be presenting a free paper on comparison of visual outcomes of Indian Appasamy and multinational company Vivinex toric AIOS under the guidance of Dr. Amit Porwal sir. Not work. So there was no financial disclosure. So in today's world, the cataract surgeries are aiming to make the person emmetropic. So corneal astigmatism is traditionally managed using prescription glasses and contact lenses. In one of the studies conducted in India on 2502 eyes with cataract, 40% of them had astigmatism greater than 1 diopter. On another study, around 33% of the patients undergoing cataract surgery have preoperative corneal astigmatism of more than 1 diopter, with 22% having more than 1.5 diopter and 8% having more than 2 diopter of astigmatism. So various surgical options are there to treat the corneal astigmatism, such as PRK, LASIK and excimer lasers. However, there are certain limitations to this. That's why the toric IOLs have become increasingly popular in today's world. So the toric IOLs were firstly introduced in the early 1990s. So among the different types of IOLs available in our hospital, Hoya Vivinex, Alcon, Clarion and Appasamy Supraphobe are commonly used. So the purpose of my study was to compare the visual outcomes and residual astigmatism following implantation of Indian Appasamy Supraphobe toric and Hoya Vivinex intraocular lenses. So it was a retrospective case series conducted at Choitram Netralaya, Indore, in which 100 eyes were selected having astigmatism of more than 0.75 diopters. They underwent in the bag IOL implantation either with Indian Appasamy Supraphobe toric IOL or Hoya Vivinex toric IOL. There is 50 eyes in each group. The inclusion criteria of my study was the patients with uncompleted senile cataract and nuclear sclerosis ranging from grade 1 to 4 and having astigmatism more than 0.75 diopter. Any patients with having any retinal pathologies were excluded from the study. So we did a preoperative workup of the patient where we measured the UCVA, BCVA, IOP, dilated fundal examination, and we did the biometric calculation with Zeiss IOLmaster 700. The preoperatively, the reference marking was done on a slit lamp. Axis marking was done in the OT before starting the surgery. Post phacoemulsification, toric IOL alignment was adjusted to correspond with the corneal axis marking. Post-operatively, the visual acuity, both uncorrected and the best corrected, was evaluated at week 4 and the post of residual astigmatism was calculated. So based on the data, the results obtained were in the group 1, the mean age was 69.24 with male to female ratio of 31:19, and in the group 2, the mean age was 63.06 with male to female ratio of 23:27. So in group 1, the mean visual acuity preoperatively was 0.86 logMAR units, which reduced to 0.009 plus and similarly the residual astigmatism was also reduced to -0.2 from -1.61. In the group 2 also similar results were obtained with the mean visual acuity reduced from 0.83 to 0.08 and the mean astigmatism was reduced from 1.64 to -0.4. So the toric IOLs effectively treat corneal astigmatism during cataract surgery, enabling reliable in-bag placement without corneal intervention for spectacle-free distance vision. In one of the studies conducted by Tulsidas et al., he found similar post-op UDVA for Indian and imported toric IOLs. The residual astigmatism was lower in the imported ones, but clinically insignificant, similarly to our findings. Holland et al., Yang J et al., and Seth also found comparable visual outcomes and astigmatism reduction with Indian and imported toric IOLs, consistent with our findings. The p-value of the postoperative visual acuity and astigmatism between group 1 and the 2 was 0.642 and 0.325, indicating no significant difference. In our study, none of the patients had misalignment of the axis, which was evaluated postoperatively at 6 hours, week 1 and week 4. The Faruqi J.H. et al. Found eye misalignment less than 5 degree in 71.9% of eyes and less than 10 degree in 93.8%, which was similar to ours. So coming to the conclusion of my study, both Appasamy suprafour toric and Hoya Wavinex toric IOLs showed comparable postoperative outcomes in terms of UC-way, BC-way and residual astigmatism. Indian toric IOLs are at par with the multinational company toric IOLs. These are my references.